Hello, my name is Patrick. I'm going to be your student nurse today. Do you mind telling me what your initials are?
JG.
JG? All right, I'm going to go ahead and check your wristband, see if that's correct. Yep, checks out. All right, so the patient is JG. We took vitals ahead of time to save time in the video. Her temperature was 97.5 degrees Fahrenheit. Her pulse was 68 beats per minute, respirations were 16 breaths per minute, and blood pressure was 120 over 60. Uh, do you have any pain today?
No.
The patient is not experiencing any pain, so we're just going to go ahead straight into the eye assessment. So for the patient's eye assessment, we're going to start with the PERLA. The PERLA is what we use to assess the patient's reaction uh, the patient's eye reaction to light. So we're gonna have the patient look straight ahead. Go ahead and just look at my nose. So the patient's looking straight ahead. We're gonna go ahead and dim the lights. So we dim the lights, and we're gonna have the patient look straight ahead. So right now, with the lights dim, the patient's pupils, left and right, are 88 millimeters. But we're gonna shine a light on the eyes. So on the left pupil constricts when the light is shined on it, constricts to 3 millimeters, and then we're gonna shine it again, and it constricts 3 millimeters on the right side when shined on the left eye. So we're gonna do the same thing for the right eye, or that was called consensual reflex. Um, so the right eye, the pupil constricts when the light is shined on it, and then we're gonna do it again. And we're gonna look at the left eye, and the left eye also constricts to 3 millimeters when the light is shined on the right eye as a part of consensual reflex. So then we're gonna go ahead and next, we're gonna do pupillary accommodation. So we're gonna have the pen light 10 to 15 centimeters away from the bridge of the patient's nose. So we're going to have the patient look at the pen light. And then I'm going to have the patient look at my ear. And then she's going to look back at the pen light. So the patient's left pupil was 5 millimeters when looking at the pen light, which is near the bridge of her nose. And the right pupil was also 5 millimeters when looking at the pen light at the bridge of her nose. But when she looked at my ear, her left pupil dilated to 7 millimeters, and her right pupil dilated also to 7 millimeters. They went from 5 millimeters to 7 millimeters. The patient accommodated. The next thing we're going to look at is pupillary convergence. So I'm going to have the pen light 6 to 8 inches away from the bridge of the patient's nose. Go ahead and look at the pen light, and then the pen light is going to move closer to the patient's face, and we're going to watch as the pupils respond. So when the pen light moves closer to the patient's face, her eyes converge and give a cross-eyed appearance, which is good. That's normal. The next thing we're going to look at is the patient's ears. So I'm going to push the patient's hair out of the way so we can take a look at the left ear and also have it to the side on the right. So when we're looking here, we can see that the patient's ear in size is equal bilaterally. There's no swelling or thickening of the ear. The skin color is consistent with the patient's race, and the skin is intact. There's no lumps and lesions. We're going to look in the patient's ear. So both sides. All right, so there is no swelling or redness or discharge coming from the external auditory meatus. We're going to apply some pressure to the pinea, and as well, we should do it for the tragus as well. All right, so the patient should So it should feel firm, and the patient should not feel any pain. So when we were looking at the inside of the patient's ear, we were able to see a bit of cerumen or earwax. The cerumen is moist and waxy, but the presence of cerumen is normal. The next thing we're going to do is a whisper test. So I'm going to whisper a one-syllable word in the patient's ear, and she's going to repeat the word back to me. So we're going to start with the left ear.
Cat.
So the patient was able to correctly repeat the word cat back to me. And then for the right ear,
Dog.
so the patient was able to correctly repeat the word dog back to me in the right ear. So she has equal hearing in both ears bilaterally. The next thing we're going to look at is the patient's nose. So first, we're going to assess the nose externally. On the surface here, we can see that the nose is symmetrical and at midline. It is also proportional to the rest of the patient's facial features. We're going to go ahead and look inside the patient's nose. All right, so the patient's nose is, there is no signs of swelling, discharge, or bleeding. There's no lesions. And the internal nasal mucosa is pink and moist. So we're going to press down on the patient's sinuses. Do you feel any pain?
No.
So the patient should not feel any pain, but they should feel pressure. And that would be considered normal. And then the patient does not appear to have any trouble breathing. Are you breathing okay?
Mm.
All right. So next thing we're going to look at is the mouth and throat of the patient. So as you can see, the patient's lips, they're pink and moist and do not have any cracking. Go ahead and say, ah. Go ahead and show me the bottom part of your teeth. And then, normally you'd be wearing gloves, but I do not have any gloves, but I did wash my hands prior. So the patient's teeth are white and they are equally spaced and straight. They are free of debris and decay. Go ahead and say ah one more time. Show me your gums on the bottom there. So the patient's gums are pink and they are, let's see that again. Good. So the patient's gums are pink and they are tight and well defined where they meet the teeth. The patient's tongue was also pink and even. And go ahead and touch the roof of your mouth with your tongue. And the patient is able to touch the roof of her mouth with her tongue. We're going to go ahead and look into the back of the patient's throat. Okay, so the uvula is at midline. It's pink and fleshy. And then the tonsils in the back, we're going to go ahead and grade the patient's tonsils. So the patient's tonsils appear to be less than 50% from the midpoint between the uvular and the pillars. So that is a grade 2 tonsil. So then we were asked to also perform neuro in this video. So I'm going to go ahead and perform a neuro test. So do you mind telling me your initials once more?
JG.
JG. Correct. So the patient is oriented to self. She, you know where you are right now?
Hospital.
The hospital. She's oriented to place. Do you know why you're here?
For checkup.
Yes, that's correct. She knows why she's here. And can you also tell me the year?
2020.
It's 2020. So the patient's also oriented to time. She appears awake and alert and oriented. We're gonna assess her memory. Can you go ahead and tell me what you had for breakfast this morning?
Oatmeal.
She had oatmeal for breakfast this morning. That's correct. And next, we're gonna assess. We're gonna have the patient name items in the room. So I'm gonna go ahead and grab a random item. Can you tell me what this item is?
Water bottle.
It's a water bottle, correct? Tell me what this is called.
Door.
A door, correct? So the patient is able to name regular items in the room. We're going to also assess the patient's 6 cardinal gazes. So we're going to have the patient to look straight up, look down, look to the left, look to the right, top left, bottom left, and bottom right. So the patient was able to look or was able to perform the 6 cardinal gazes. The next thing we're going to do, another thing you can test the eyes for is a Snellen chart, but we also do not have a Snellen chart here. But yeah, we're going to move on to sensory function. I'm going to have the patient close her eyes. So can I go ahead and give me your hand? So we're going to test her hands both for sensory function. So we're going to go ahead and poke. You could also do this with the feet, but I don't think the patient wants her feet on camera, so we're just not going to do that. But it would be good to do that. So she's going to tell me what sensation she feels on the back of her hand. You're going to first demonstrate what a sharp sensation is. So this is a sharp sensation, all right? And this is a dull sensation. So you have to tell the patient what each sensation is first before you have them guess what the sensation would be. So, with your eyes closed, can you tell me what this sensation is?
Door. Sharp.
So, one more time.
Sharp.
So this is a sharp sensation, yes. And then
Dull.
that's a dull sensation. Good. So what is this one?
Sharp.
Correct.
Dull.
Dull. Correct. So the patient was able to correctly tell me what sensation she felt, sharp and dull. Next, we're gonna have the patient smile for us. Okay, I want you to show me your lower teeth. Good, good. I want you to purse your lips. All right, good, good. She was able to follow those commands. And next, we're gonna have the patient stand up and test do the Romberg test. Go ahead and stand up for me. So when we're doing the Romberg test, we want to make sure the patient does not sway. So the patient does not appear to be swaying in any direction, which is good. And since the patient's already standing up, we're going to have her also do, we're also going to assess for the patient's gait. So for the patient's gait, we're going to have the patient walk towards me on her toes. Go ahead. All right, go ahead and walk backwards on your toes. Can you walk on your heels? All right, the patient, you won't be able to see this in camera, but the patient was able to perform the gait test on her toes, and right now she's walking towards me on her heels. Go ahead and walk towards me with your heels. Oh, towards me. All right, and go walk backwards. All right, and then next, I want you to walk towards me in straight line with your heels to your toes. I guess the best way to describe it is walking on a tightrope. And the patient is able to do that. Go ahead and walk back to his feet. You can go ahead and sit down. So the patient was able to perform a gait test, and she was normal. Her next thing we're going to do is a motor function test. So I want the patient to go ahead. We're going to have the patient with her hands tap her fingers to her thumbs in a rapid motion with both hands. So, yeah. So the patient is able to do that. It's symmetrical and in coordination. Next, we're going to have the patient pat her thighs with both her hands. Well, I guess you don't see that on the camera, but she's able to do that. And then she's going to tap her feet on the floor. Good. And the patient is able to do that in coordination as well. And I believe that's all for the neuro portion of this video. And I think that's all for the video. So thank you.